In the words of our great leaders of the past, I can look out at this audience and I can see into your hearts, and I know that they are in the right place. Thank you for being here, and I am indeed privileged and have a great pleasure to introduce to you our first keynote speaker. Now, if you will look at these pictures behind me, you will see the example of what we are here for and about. From the time that these children come into the world until they're old enough to play basketball at the University of North Carolina, Dr. Tayloe Dr. David Tayloe has been responsible in this state and in this nation and indeed around the world for seeing that they have the very best health care possible. As president of the American Academy of Pediatrics, he speaks for nearly 70,000 pediatricians in this country who are about providing that kind of care. But indeed, he is carrying the message all over the world that children should be first and that they should indeed have a smart start in life. He comes to this identity and this position well prepared. As a North Carolinian, educated at UNC, and as part of his training at the St. Christopher's Children's Hospital in Philadelphia, as well as here in North Carolina, he is a consummate pediatrician with the intellectual capacity to do his job well. But not only is he prepared to do his job well as a pediatrician, but he has prepared himself well to serve America's children by the work that he's done in his own community in Goldsboro. There, in 1977, he began a practice of pediatrics which has spread in its influence across the state and the nation, providing health care in a comprehensive, holistic medical home model that is second to none. He has served on the Wayne County Board of Education. He has advanced the programs for prevention of teen pregnancy. He has instituted in North Carolina ways to improve immunizations for children and the Vaccines for Children program, which ultimately became the model for the entire country. He has provided for us through his efforts the initial way that children's health insurance programs in North Carolina were formulated, which again became a model for the rest of the country. He has become legendary in his leadership in the American Academy of Pediatrics, serving as president of the state chapter and going on to serve as chair of the State Government Affairs Committee, on the chapter forum committee, on the district as district chair, and now finally as a president of the American Academy of Pediatrics. On into the future, Dave's image, Dave's leadership, Dave's qualities that have brought him to this position today, that honor, respect, and depend upon the nature of children to lead them into better lives and to incorporate those models of understanding into their families and parents will indeed make us all have a healthier population of people. It gives me great pleasure to introduce to you my friend, my colleague, Dave Tayloe Jr., President of the American Academy of Pediatrics.
Thank you very much, Olson. Olson followed me as president of the North Carolina chapter of the American Academy of Pediatrics, and after he finished giving me my plaque at our annual banquet when he took over, I told my wife I should have just died right then. That I will never be eulogized to that extent ever again. So here we are again, Olson. As many of you are aware, this is a tough time to represent children, a tough time to hang in there, and I applaud you for taking a little bit of time off from our really important work to come to a meeting like this to reflect. Winston Churchill, when he was between his terms as Prime Minister in England, was asked why he left London and went out to the country. And he had a very simple answer: to think. And we go to meetings to think. This is a year of thinking for me because I was immersed in primary care in Goldsboro for over 30 years, and in October of last year just had to leave because I'm on a different airplane and in a different hotel just about every night, and I had to drop out of practice. And I assure you, during this year that I am out of practice, I am thinking a lot about what my practice will look like when I go back. And I hope during this conference you'll be thinking outside the box as to what your programs will look like when you go back. I would say that for a pediatrician to be up here is humbling, because pediatricians have not necessarily addressed the holistic needs of children and families much as you do every day. So I think we do have a common bond, and in many ways you are doing a better job of addressing our problems with assuring good child outcomes, a better job than medicine. I apologize for the academic nature of this presentation. This is the slide that we need to focus upon so that you can understand how we desperately need each other. In the Healthy People 2010 report, there were statistics that brought out the weakness of medicine in addressing child outcomes. In other words, I spent nearly every minute that I was awake learning how to provide really good, direct medical services and keep children from dying on my shift before I decided to leave the ivory tower and go to Goldsboro, where when you look around for the team, you look in the mirror. So, most of your doctors come out of training just like that. They're really good at medical care. But the factors that influence child health, as you can see, are health behaviors to the tune of 50%, obesity, mental health, parenting issues, certainly. The environment, whether it's lead, tobacco, smoke, pesticides, and then the just exploding field of genetics. I expect before I completely hang it up in pediatrics, I'll be doing some little genetic screens in my office to tell parents if their children are really going to have type 1 diabetes, type 2 diabetes, hypertension, the maladies that are so expensive in adults that have their origins in childhood. But as you look at this, I think you would understand why a community pediatrician would reach out to you and say, teach us what you know. We are at the American Academy of Pediatrics trying very hard to teach our pediatricians to address the whole ball of wax, if you will, that is child health. But it's physical, it's mental, and it's psychosocial. And most of what I've learned about community pediatrics, certainly mental health, psychosocial pediatrics, I've learned by the seat of my pants trying to address the needs of my patients. Our strengths that we want our children to have are best embodied in the agenda of America's Promise. I'll remind you that Alma and Colin Powell founded this group and were supported by the living presidents over 10 years ago, and they boiled down the Search Institute assets. Many of you may have read Search Institute material. The name that goes with a lot of that is Peter Jensen, where if children have the majority of 40 assets, they're likely to have good outcomes, and the average American child has just 18. If you read the Search Institute list, you would conclude that you have about 39 of 40, probably. But